1. The Pharmacy College Admission Test, PC, is administered by which organization? American Association of Colleges of Pharmacy, AACP. B. Pearson VUE. C. National Association of Boards of Pharmacy, NABP. D. Educational Testing Service, ETS. 2. Which of the following sections is not part of the current PCAT exam structure? Biological processes. B. Chemical processes. C. Physics and calculus. D. Critical reading. 3. What is the total testing time for the PCAT exam, including breaks? A. 3 hours. B. 4 hours. C. 4 hours and 15 minutes. D. 5 hours. 4. According to test-taking strategies for the PCAT, what approach is most effective for managing time during the exam? A. Spending equal time on all questions regardless of difficulty. B. Answering easier questions first, then returning to difficult ones. C. Reading all questions before starting to answer any. D. Completing sections in reverse order. 5. The PCAT writing section assesses which primary skill? A. Creative fiction writing. B. Problem solving and critical thinking through written communication. C. Poetry analysis. D. Medical terminology knowledge. 6. What is the scoring scale for each PCAT section? A. 0, 100. B. 200, 800. C. 130, 170. D. 200, 600. 7. How many times can a candidate take the PCAT within a testing year? A. Unlimited attempts. B. Once per year. Up to 5 times. D. Up to 3 times. 8. Which content area has the most questions on the PCAT biological processes section? A. Molecular biology only. B. General biology, including anatomy, physiology, and microbiology. C. Genetics exclusively. D. Botany and plant sciences. 9. When preparing for the PCAT quantitative reasoning section, which mathematical concept is most heavily tested? A. Trigonometry and advanced calculus. B. Basic algebra, probability, statistics, and pre-calculus. C. Differential equations. D. Linear algebra and matrices. 10. What is the primary purpose of the PCAT critical reading section? A. To test vocabulary memorization. B. To evaluate comprehension, analysis, and evaluation of reading passages. C. To assess speed reading abilities. D. To measure creative interpretation skill. 11. According to adult learning principles, what is the most effective study method for PCAT preparation? A. Passive reading of content for hours. B. Active learning through practice questions and self-testing. C. Memorizing formulas without understanding concepts. D. Studying only the week before the exam. 12. Which of the following is a recommended strategy for the PCAT writing section? Writing as much as possible without planning. B. Using complex vocabulary regardless of context. C. Planning the essay structure before writing and supporting arguments with examples. D. Avoiding taking a position on the prompt. 13. The PCAT chemical processes section covers which of the following topics? A. General chemistry, organic chemistry, and basic biochemistry principles. B. Advanced physical chemistry only. C. Industrial chemistry exclusively. D. Environmental chemistry only. 14. What type of calculator is permitted during the PCAT exam? Any graphing calculator. B. Scientific calculators with specific features. C. No calculators are permitted. An on-screen calculator is provided. D. Financial calculators only. 15. When should candidates ideally take the PCAT in relation to their pharmacy school application? A. After submitting all applications. B. During pharmacy school. C. Early enough to receive scores before application deadlines. Only if required by all schools. 16. What is the typical score considered competitive for admission to most pharmacy schools? A. Below 50th percentile. B. 50th, 60th percentile, C. 70th percentile and above, D. 90th percentile or nothing. 17. Which study resource is considered most valuable for PCAT preparation? A. Only reading textbooks without practice. B. Official PCAT practice tests and review materials. C. Unverified internet sources only. D. Study materials for different exams. 18. The PCAT biological processes section includes questions on which system? A. Only the cardiovascular system. B. Multiple body systems, including nervous, endocrine, and immune systems. C. Only plant biology systems. D. Exclusively microbial systems. 19. What is the recommended timeline for comprehensive PCAT preparation? A. 1 to 2 weeks. B. 1 month. C. 2 to 4 months with consistent study. D. 1 year of daily study. 20. Which of the following is true about PCAT score reporting? A. Scores are automatically sent to all pharmacy schools. B. Candidates can select which scores to send to schools. C. Scores are never released to candidates. D. Only percentile ranks are reported, not scaled scores. 21. In the PCAT quantitative reasoning section, what percentage of questions typically involve word problems requiring application? A. Less than 10%. B. Approximately 25 to the 30%. C. Approximately 50 to 60%. D. Over 80%. 22. What is the most common reason for low performance on the PCAT? A. Lack of test-taking strategies and inadequate content preparation. Test anxiety alone. C. Insufficient sleep the night before. D. Not bringing proper identification. 23. The PCAT writing prompt typically requires candidates to A. Memorize and recite a passage. B. Solve a mathematical equation. C. Present a solution to a problem and support it with reasoning. Translate scientific terms. 24. Which content review approach is most effective for the chemical processes section? A. Memorizing without understanding mechanisms. B. Understanding concepts and practicing application through problems. C. Only reviewing organic chemistry. D. Skipping general chemistry entirely. 25. What accommodations are available for candidates with documented disabilities? A. No accommodations are ever provided. B. Extended testing time and other appropriate accommodations with proper documentation. C. Automatic score increases. D. Different test versions with easier questions. 26. When interpreting PCAT scores, what should candidates understand about percentile ranks? A. They compare your performance only to your school. B. They compare your performance to all test takers over a 3-year period. C. They are irrelevant to admissions. D. They are the same as your raw score. 27. Which of the following is a critical component of the PCAT biological processes section? A. Understanding of basic biological principles and human anatomy physiology. B. Advanced veterinary medicine. C. Agricultural science only. D. Marine biology exclusively. 28. What is the best strategy for guessing on the PCAT when unsure of an answer? A. Leave it blank as there is a penalty for wrong answers. B. Make an educated guess as there is no penalty for wrong answers. C. Always choose answer choice C. Skip all difficult questions. 29. The PCAT critical reading section passages are drawn from which types of sources? A. Only pharmaceutical journals. B. Fiction novels exclusively. C. Various scientific and general interest topics. D. Only chemistry textbooks. 30. What is the primary skill assessed in the PCAT quantitative reasoning section? A. Speed of calculation only. B. Mathematical problem solving and quantitative literacy. C. Advanced theoretical mathematics. D. Mental math exclusively. 31. How long are PCAT scores valid for pharmacy school applications? A, 1 year. B, 2 years. C, 5 years. D, scores never expire. 32. Which study technique is least effective for PCAT preparation? A, creating a study schedule and sticking to it. B, taking full-length practice tests under timed conditions. C, cramming all material the night before the exam. D, reviewing weak areas identified through practice tests. 33. What is the recommended approach for the PCAT writing section regarding essay length? A, write as little as possible to save time. B, focus on quality and coherence rather than just length, but develop ideas thoroughly. C, write multiple pages regardless of content quality. D, use only bullet points instead of paragraphs. 34. In the PCAT chemical processes section, understanding which concept is essential. A, only memorizing the periodic table. B, chemical bonding, reactions, stoichiometry, and organic chemistry mechanism. C, advanced quantum chemistry exclusively. D, industrial manufacturing processes only. 35. What percentage of pharmacy schools require or recommend the PCAT for admission? A, less than 25%. B, approximately 50%. C, the majority, though this has been decreasing in recent years. D, 100% of all pharmacy schools. 36. What is the recommended approach for reviewing incorrect answers on PCAT practice tests? A, ignore them and move on to new material. B, analyze why the answer was incorrect and review the underlying concept. C, memorize the correct answer without understanding. D, assume it was a careless mistake and don't review. 37. Which of the following best describes the PCAT's purpose in the pharmacy school admissions process? A, it is the sole determining factor for admission decisions. B, it serves as one component of a holistic review alongside GPA, experience, and interviews. C, it guarantees admission if a minimum score is achieved. D, it replaces the need for prerequisite coursework.